So we created the Graham Boeckh Foundation over 15 years ago to honor my son Graham, who was afflicted with schizophrenia and unfortunately died from the medications that he was taking. In simple terms, our mission is to be a catalyst for transformational change in the mental health care system to benefit patients and their families. And what is, I think, evident to everybody is far too many people fall through the cracks in spite of the best efforts and the dedication of thousands of brilliant professionals. We need change, transformational change. Sam Lal had many accomplishments, but he's probably best remembered for a few particular things that he did. In 1979, with Dr. Nair, he set up the research center at the Douglas Hospital. In 1980, he set up the brain bank at the Douglas Hospital, the first in Canada. A few years later, he obtained funds from the EJLB Foundation to set up a schizophrenia research center. And then he worked very closely with us in the mid-1990s to help set up the Graham Boeckh Chair in Schizophrenia at the Douglas Hospital and McGill University. There are two people who knew Sam Lal very well, worked with him closely at the Douglas Hospital, Jacques Hendlis and Dr. Nair.
His legacy is he left a bit of himself which has formed the culture of the Douglas Hospital Research Center. He was gentle, he was extremely humorous, he was very focused, incredibly caring about his patients, and he was really caring about science.
It's always a great pleasure to talk about Sam. We had the same philosophy of research, meaning that research should go from the bedside to bench and only later the other way. Our belief was research should contribute to the improved care of patients. He was very persistent, that there were a number of projects I thought was too difficult, too time consuming, but because of his persistence, we were able to continue the projects. Even when he was sick, his thought was always on the completion of the last project. 2 days before he passed away, he telephoned me saying, "Our paper has been accepted." So this was the most moving moment of my life. So unfortunately, he's no longer with us. I miss him a lot.
We're absolutely delighted with the Independent Selection Committee's choice of this year's recipient of the Sam Lal Award for Mental Health Research.
The first line of research is in treatments. We emphasize developing brain stimulation research in patients who are not responding to medications, and those are patients typically with depression, obsessive compulsive disorder, schizophrenia, and bipolar disorder. And so the type of research that we do is called repetitive transcranial magnetic stimulation treatment research. And it involves stimulating the brain with light magnetic fields that are easy to tolerate, that have virtually no side effects, but have tremendous therapeutic potential. The second therapeutic innovation that we've been involved in is called magnetic seizure therapy. Magnetic seizure therapy is like RTMS in that it involves magnetic fields, but those magnetic fields are designed to achieve a seizure. Now, people hear about seizures being induced and get worried, but the truth is that seizures themselves have actually tremendous therapeutic impact on the brain. It's the side effects that are associated with seizure that everyone is concerned with, and magnetic seizure therapy actually prevents or avoids some of the terrible side effects that can be associated with other forms of seizure therapy, including electroconvulsive therapy. The research is really about improving patients with severe psychiatric illness, improving their symptoms, but also it really centers around understanding how that improvement takes place in the brain, which leads to the second type of research that we do, which is physiology. So we understand the brain by understanding its physiological mechanisms. And there are numerous physiological mechanisms that take place in the brain. I must say I'm not a religious person, but I must say I'm extraordinarily blessed by the team I have around me. the team is wonderful, and the hospital, CAMH, has been wonderful in supporting this program. But the type of research that we're involved in is, to me, even more appealing, because not only are you making breakthroughs, but you're actually transforming people's lives, you're helping people, you're treating people. So I'm extraordinarily grateful to be the recipient of the 2013 Samarthji Lal Award for Mental Health Research.